for being here. And first of all, I would like to thank Anna and Lynn for the introduction. My name is Roberto Cittadini, and I'm currently a CAS fellow at CERN since 2024. My background is at the intersection of biomedical engineering, artificial intelligence, and human-centered technologies. And I hold a master's degree in biomedical engineering with a specialization in robotics, followed by a PhD in human-centered technologies, where I focused on developing technologies designed around people needs and capabilities. Today at CERN, I work on human sensing and physiological monitoring technologies. My research explores how sensors, machine learning, and AI can be used to understand the overall human state in real-world environments. And over the years, I've become increasingly interested in applying these technologies to healthcare. And my work has a focus on AI-driven human sensing, physiological monitoring, and health statement assessment, with the goal of transforming data into meaningful information that can support both patients and medical professionals. So this combination of background, expertise, and interest led to the project I'm going to present today. So let me briefly outline what I would like to cover today. I will first introduce the environment where this work originated here at CERN, and then explain the motivation that led us to create VitaSense AI, providing the background and motivation behind. Then I will discuss the technology itself and our collaboration with hospitals and clinical partners, highlighting how these partnerships are helping us in translating research into real-world impact. After that, I will then present several use cases where we see immediate value and future opportunities. And finally, I will conclude with our vision for the future and hopefully start a discussion how we can work together moving forward. So, to understand why we started working on this topic, it is important to briefly introduce the environment where the project was born. CERN is the world's largest particle physics laboratory and hosts a complex network of facilities and accelerators, including the Large Hadron Collider, which is this one. So the LHC, a 27-kilometer accelerator placed at 100 meters underground the surface. And these facilities span an extensive area, and these areas are accessible only through specific entry points by elevators. As a result, in the event of an emergency, reaching a person in need can be challenging and time-consuming. So now imagine that a fire breaks out at the random location inside the LHC. So according to the investigation conducted by the CERN fire brigades, intervention time can reach up to 22 minutes, depending on the access point, and the distance must be covered inside the tunnel. And this is a simulation of the smoke propagation. And during those critical minutes, situational awareness becomes essential. We need to know whether people are present, where they are located, and what are their conditions. So in this context, robotic technology can make a real difference. For instance, mobile robots can be deployed ahead of the rescue team to search for survivors, identify their location, assess the surrounding environment, and even monitor vital signals such as respiratory activity in contactless way. So by providing this information, the robot can support the first responders, improve decision making, and ultimately help save lives. So as you can see, the idea behind this project originated from this emergency challenge we were facing at CERN. And as the project evolved, we started to think to translate and apply the same concept to healthcare. The potential benefits are significant. First, contactless monitoring is completely unobtrusive and no invasive for the patient. So patient doesn't need to wear sensor, electrodes, or additional device, making the monitoring process more comfortable and less disruptive. And second, with the COVID-19 pandemic, we understood how much is important the concept of distance. So by monitoring, by monitoring patient by distance, healthcare professional can reduce unnecessary exposure to infectious disease. So during the COVID, several medical staff got infected trying to take care of patients at risk. And also another important advantage is that it doesn't require the skin contact. So this means that a traditional monitoring system often rely on electrodes attached to the body, and this is fine. But for some kind of patient, such as newborns with very fragile skin or burned people, could be an important solution. Moreover, a contactless monitoring system is a reusable device, so can be used by multiple patients without requiring disposable components, while a contact base should be personal, or at least you have to sanitize every time the system. And finally, one of the most exciting aspects is also accessibility. Many of these solutions that I will show you can leverage hardware that are already widely available. So such as standard cameras, webcams, making the physiological monitoring more scalable and easier to deploy. So one of the key goals of VitaSense AI is to adopt the technology to humans rather than forcing humans to adapt to technology. So our approach combines both physiological and non-physiological signals to obtain a more comprehensive understanding of a person's condition. And instead of relying on a single source of information, we integrate multiple data streams to improve robustness and reliability. Another important aspect is the usability. So the system is designed to be market-free and require no calibration, making it easier to deploy in real-world environments, and reducing the burden on both patient and healthcare professionals. And most importantly, we are addressing some of the current limitation of monitoring technologies. So many solutions perform very well in controlled laboratory settings, but our objective is to develop systems that remain accurate, reliable, and practical also under real-world conditions. So let's now look at how the research activities within VitaSense AI have evolved over the years. So our work can be broadly grouped in three main research areas. So the first focus on contactless heart rate monitoring, where we investigate how physiological information can be extracted remotely from the face, in particular the heart rate. The second area is the contactless monitoring for the respiration. So with the objective to assessing breathing patterns and respiratory activity using no invasive technology. And finally, we have also expanded our research beyond the physiological parameters, so including also non-physiological monitoring, such as body tracking, human detection, facial analysis. And these complementary sources of information provide important context and help us build a more complete understanding of the person condition. So together, these three areas form the foundation of the VitaSense AI. And let's start from the first block, the heart rate contactless monitoring. So using a standard camera, we can detect tiny changes in skin color caused by blood circulation beneath the skin every time the heart beats. blood is pumped through our blood vessels, producing a small variation in blood volume. And these changes are not visible by human sight, of course, but they create subtle color fluctuation on the skin surface that can be captured and detected by a camera. So the face is an ideal region for this purpose because is highly vascularized, and areas such as our cheeks and our forehead are full of blood vessels, making them particularly rich in physiological information. So the challenge is that the signals we are looking for, so the heart rate is extremely small and can easily be affected by lightning variation and also subject movements. So therefore, we use signals processing and deep learning techniques to separate these unwanted effects from the component that is actually related to the blood flow. By isolating these pulsatil signals, we can accurately estimate the heart rate without any physical contact. And the results are very promising. To validate the robustness of our approach, we first tested the system on several public available datasets containing subjects under different conditions, including resting, speaking, walking on a treadmill or cycling on an exercise bike. And then, of course, this scenario allowed us to evaluate the performance of the algorithm um, under both static and motion-related conditions. And in addition, a preliminary clinical study was conducted in collaboration with the University Hospital of Lille, involving healthy participants in a hospital environment. And This enable us to assess the technology in more realistic healthcare settings. And across these evaluations, our system demonstrate performance very close to reference clinical device, achieving an average error of approximately plus or minus 2 bit per minute, so 2 BPM. So these results confirm that reliable heart rate monitoring can be achieved using nothing more than a conventional camera. Now moving to the second area related to the contactless respiration monitoring. Respiration can be monitored in a contactless way using a class 1 lasers and also a time-of-flight camera, which are completely safe for the human use. And the principle is based on detecting the small movements of the chest and the abdomen that naturally occur during the breathing cycle, so inhalation and exhalation. And by tracking these movements over time, we can reconstruct the respiratory signals and estimate the breathing rate through peak detection algorithms. So in this plot, you can see the respiratory waveform measured by the laser system compared with the reference signals. And in this case, the ground truth was provided by an elastic respiratory belt worn by the subject. And as you can see, the two signals closely overlap, showing that contactless approach is able to accurately capture the breathing activity without requiring any sensors attached to the body. And this approach is particularly effective when, of course, the person, the patient, the worker are lying down, sleeping, or even unconscious, making it highly relevant for emergency response or healthcare applications. And but we further developed also um, we explored the respiration monitoring using a time-of-flight camera. So to have not only the one dimension measurement um, as the solution of the laser before, but also to understand at 3D level what is going on. So with a time of flight camera, we generate a 3D point cloud of the person body, providing information. Sorry, providing providing depth information. So to analyze the respiration, we developed an algorithm that first identify, as you can see here, the key body landmarks that we are interested on, so shoulders and hips. And then using these reference points, the algorithm is developed in order to automatically define the torso, so the torso region, so including both the chest and the abdomen where the respiratory motion occurs. And when then when we then track the movement of the 3D points within this region over time, the displacement are very small, but the system is able to capture the waveform and to filter the little artifacts. And as we show in the video, by analyze these subtle movements, we can reconstruct the respiratory waveform and estimate the breathing rate without any physical contact with the person. And then now let me know move on the third research area, so which focus on non-physiological signals, while heart rate and respiration provide important information about a person's physiological state. They don't tell the whole story, let's say. So to obtain a more comprehensive understanding of an individual, we also investigate the context in which the person is included, monitoring the body tracking and also the facial detection. So beside physiological parameters, there are other important indicators that can provide valuable information about the person health status. And one example, as I said, is the body pose estimation. So by tracking the position of different body segments, we can assess posture, mobility, and movement patterns. So at CERN, these technologies were initially developed for application in for the LHC facilities, but they can be easily transferred to healthcare environments. So in hospitals and also in rehabilitation settings, as we will see before in the next slides. Body tracking can help clinicians objectively evaluate a patient mobility and monitor recovery progress over the time. And regular assessment can reveal whether a patient is improving, maintaining their condition, their range of motion, or experiencing a decline, maybe. So to achieve this, we developed a body tracking algorithm based on MediaPipe. It's an open source framework for real-time pose estimation, but we add some layers. So we extend it with additional capabilities, including movement tracking and repetition counting, which is particularly useful for rehabilitation exercise, for example. And this can also classify different postures by analyze body joints, angles, and head orientation. For instance, as you can see in this video, it's possible to see it's possible to determine where a person is looking by estimating the orientation of the head and gaze direction. So these are non-physiological non-physiological signals that could be added to the vital one in order to have a comprehensive and overall health state of the person. So far, I presented the key technologies of VitaSense AI. So the next question is how can these technologies be translated into real-world impact? So let's now explore some practical applications and use cases, showing how the combination of physiological and non-physiological monitoring can support healthcare professionals, improve patient assessment, and contribute to more personalized and tailored effective care, but also in the field of safety for the industrial context. So let me start from the industrial scenario, so where this project originally began. So looking ahead to the future circular collider facility, expected to be nearly 3 times larger than the LHC, ensuring worker safety will become a great challenge. So in such environment, automation should not be limited to technical system alone, but also can be used to support the monitoring and the protection of the personnel by providing information about workers' presence, activity, and condition. So a key advantage is that this approach can leverage existing infrastructure. So basically, cameras are already installed on several robots that we have already at CERN, for example, and could be used not only for inspection tasks, but also to enhance worker safety and situational awareness. So this makes the solution both practical and scalable for the future facilities. Beyond CERN, this technology could be applied in a wide range of industrial environments where worker safety and situational awareness are critical, including also offshore platforms, nuclear facilities, chemical plants, and construction sites. For instance, could be used for worker monitoring in remote and hazardous environments, also for enhance safety and reduce the exposure of risks, and also to detect, for instance, fall detection and safety monitoring in dynamic workplaces. And now let me move on to the healthcare domain, so which is currently one of the main application areas of VitaSense AI. So over the years, we have established also a close collaboration with the Hospital of Lille, working with the clinicians and healthcare professionals, and the continuous exchange of feedbacks has been essential in adapting the technology to real clinical needs and ensuring that the developed solutions are practical and relevant for daily healthcare practice. So one of the projects we are currently involved is related to the continuous monitoring of vital signals, particularly heart rate, respiration rate in geriatrics and burn ward. And just to give you the context of this safe supervision in hospitals and care facilities, fragile elderly patients face constant safety risks, including fall, wandering, agitation, and also self-harm. And the challenge is not a lack of care, but a lack of continuous visibility of this patient. Most accidents occur between routine checks, especially during night shift when staffing levels are lower. Typically, the ratio between nurses and patient range from 1 to 8 during the day, and can increase to 1 to 15 during the night. So current solution have important limitation. Routing rounds leave long period without observation. So alarms often react only after an accident has occurred, and measure such as so basically after the event is already happened. So also at the same time, one-to-one supervision is costly and not always available in all the facilities and structures. So many warning signs actually appear before an event like that. So patient may become restless, change posture, or show altered breathing pattern before a fall, for example. Similarly, for instance, changes in sleep and in activities can precede some event of agitation, for instance. So these subtle signals can provide important and early indicators, but they are difficult to monitor continuously in a busy clinical environments. So The idea is to provide a continuous safety layer, so monitor micro movements, posture, respiration, heart rate trends, all without touching the patient. So rather than reacting to the accident, try to detect the risk of escalation early and alert the staff while there is still time to act, let's say. So the earlier detection of false wandering and self-harm reduce also could reduce the also the frequent round and could be um, a time safe for as time safe for the medical staff that they can use this time for other activities and priorities. So another use case is the rehabilitation, the adaptive rehabilitation. The rehabilitation still relies largely on what we see and what the patient tell us. But many patients, especially elderly and fragile people, cannot reliably express pain or fatigue, and therapists sometimes do their best, of course, but subtle warnings signals are often missed simply because continuous objective monitoring is not feasible. So this create what the clinicians call the Goldilocks dilemma. False and safety concerns limit therapy intensity. So, too caution means slower recovery, but too aggressive rehabilitation path means injury or fear by the patient. So, push too little, the recovery is low, but push too hard, pain, fear, and injuries could appear. The therapists are forced to constantly guess the appropriate intensity. Um, so the idea is to support with objective objective evaluation of objective measurements, so making the therapy measurable without touching the patient. So correlate how the patient moves with how their body responds, also in terms of heart rate, breathing, posture, balance, and even facial indicators. In this way, the therapy could be objective and personalized and tailored to each unique needs of the single patient. The idea is to try to detect the risk earlier and predict them. In this way, the patient feel safer, progress faster, and we can, for instance, take track of the range of motion each day, day by day. The angles, for example, as you can see in this video, the angle at the elbow level. And The idea is absolutely don't replace the clinical judgment, of course, but try to support, to empower clinical judgment, supporting therapists and medical staff and not replacing them. Is a technology in order to support the um, the rehabilitation. And in parallel, the development of the monitoring algorithm, we are also developing a graphical user interface with the objective to not only provide accurate measurements, but also present information in a clear and intuitive way for the medical staff. So what you see here is a version 1.0 of the platform, developed based on the feedback collected so far from the clinician from the hospital of Lille. And this is just the first step, let's say. So the idea is the medical staff can select what the physiological signal that I want to monitor, and select also the minutes of the monitoring and launch the session, and see a graphical user interface where can take track of what is going on. Then we have also another project. Let me introduce this second clinical application related to the children awakening prediction. So the predicting when a child is about to wake up during sedation. So this project focuses on children who are under anesthesia and connected to a breathing machine to help them to breathe. A tube is placed in at the throat level. So as you can see in this image, the problem arises when a child starts waking up unexpectedly. So their natural reaction, the first reaction of a child is often to move and try to pull out the tube. And this can be very dangerous and may cause injuries. And today, nurses mainly rely on regular checks to monitor these patients. However, the first signals of awakening can be very subtle and easy to miss. So, a common approach is to keep the level of sedation slightly higher than necessary to reduce the risk of unexpected awakening. While effective, these may result in patient being sedated longer than needed, and this is quite dangerous. So the goal is to provide an additional tool that helps clinicians better understand when a child is about to wake up and intervene at the right time. So based on discussion with medical staff, the idea is to try to see if there are any signals that could be could function could be like an alert for the awakening, the unexpected awakening. Um, so to conclude, what started as a research activity focused on contactless monitoring for safety application at CERN has, let's say, gradually evolved into a broader vision. And today, from us, it's possible to extract meaningful information using contactless sensors, including heart rate, respiration, posture, movement, range of motion, and facial information. The ultimate goal is not to measure individual parameters, but the vision is to combine physiological and non-physiological signals into a single intelligent system capable of continuously assessing a person condition in real time. So in healthcare, this could support clinicians with continuous monitoring, early detection of critical situations, as I showed you in the previous slide, and more personalized and tailored patient care. So try to adapt the technology to the human, not vice versa. And industrial environment, it could be enhanced worker safety and situational awareness in complex and hazardous settings. So this is what we have, and this is more or less our future view and next steps. We want also to explore other paths, as you can see in this slide. And the next step is to validate it at scale and strengthen the collaborations with hospitals and industrial partners, and try to transform these research outcomes into a solution that can create real impact. So I don't know if I was in time, so thank you very much for your attention. Looking forward your feedback, question, and potential collaboration.
Thank you so much, Roberto, for the next presentation. Yes, on the screen here, you'll find the tech brief that we have about the technology that's also on the events page. And if you have any interest about the technology, just feel free to contact myself or Lynn, and we'll be able to discuss it with you.